Hello, everyone. Have you ever gone to the pharmacy and gotten your prescriptions that the doctor prescribed and seen those little cards that they have on the counter? These little prescription discount cards, or have you ever heard of the GoodRx card and others, the Script Save, and those discount prescription cards? Well, you probably have seen them, you probably heard about them, you might even use them. But do you really understand how they work? Well, that's what I thought I would talk about today and why you want to use a prescription discount card. So there's a lot of these cards available. And it's curious if you actually use multiple cards and shop your prescriptions across multiple cards, you will see that their pricing is different. And if you think about what they're doing, these discount prescription cards are bringing customers to the doors of these pharmacies. And the bigger their network of users are, the more leverage they have with these pharmacies to be able to get them to lower their price for their prescription drugs. GoodRx is probably one of the largest ones out there. So typically their prices are the best, but not always. Now, typically, you'll see that the pharmacies are going to negotiate prices on all sorts of drugs. And their motivation in doing so is to get your business and to get your additional business. With these prescription drug cards, what I typically see across my clients is that a Sam's or a Costco are going to have the lowest prices for their prescriptions on these cards. Many of these cards, you can get an app on your phone and then put in your prescription with your zip code, and it'll tell you the prices for all the pharmacies in your area. And you'll typically see that a Sam's or a Costco are going to be the lowest price. The next best price that you're going to see is going to be from your grocery stores. And then typically the worst price you're going to see with the least amount of discount is going to be your standalone pharmacies, like your CVS's, your Walgreens, and your independent pharmacies. Well, if you think about what these pharmacies are doing when they are negotiating with these prescription discount cards, if it's a Sam's or a Costco or a grocery store, they know if they can get you in there for your drugs, you're likely to shop and buy more from them. And so they're more likely to discount those prescription drugs at a deeper discount than, say, a pharmacy. Think about it. How many times do you actually go into the pharmacy to purchase your prescription, or do you simply just go through the drive through? And if you go through the drive through, then of course, all you're going to be buying is prescriptions. But even if you go in and purchase your prescriptions, you are likely going to the counter, getting it filled, and then exiting without buying anything else from the drugstore. Now, I want to share a story that one of my clients had using one of these prescription drug plans. So, this client enrolled with the plan that I primarily work with in my health insurance business. And she called me the first time that she had to have a prescription filled. She called me and said, Steve, I'm at the pharmacy and they're telling me that this is going to cost $90 to fill this prescription. And that seemed like an awful lot of money. And this wasn't anything fancy. It wasn't a or new type of drug. There was no reason that I could see why it should cost $90. So I asked her, I said, well, did you get onto GoodRx or ScriptSave or one of the other discount apps? And she goes, no, I didn't have time. Well, being in the industry that I'm in and servicing my clients, I was on my phone. I had GoodRx on the app or the app on my phone. And so I simply punched in her zip code. I asked her for the prescription. I punched that in and I said, well, there's a grocery store that lists this for $27. Where is that grocery store in relation to where you're at? And you know what she told me? She said that the grocery store was sharing the parking lot with the pharmacy that she was in. Well, needless to say, she transferred her prescription over to the pharmacy, over to the grocery store, because it was going to save her obviously $63 over what the pharmacy price could be. So these prescription discount cards absolutely do work. In fact, there's even plans with, say, like Walmart, where you can purchase, I think it's the Walmart Plus plan. And for $12 a month, you get delivery of your groceries as well as some $0 prescriptions. So this is really worth your money if you are filling regular prescriptions, because Walmart will provide those discounts at even a deeper level because you're paying for their Walmart Plus service. Here's a little bonus tip. Now, if you purchase or if you require a prescription and it's a very expensive prescription, and even the discount cards can't bring the discount low enough, pretty much every pharmaceutical company in the world will provide an opportunity for you to get that at a lower cost for a period of time. So one of the things you can do when you get that prescription and say it's several hundreds of dollars, you can actually go to the pharmaceutical company's website for that drug. All you have to do is Google the name, and the website is likely to be the first result. Click on that and then search through the website and find if there is any discount card or any financial assistance that the pharmaceutical company is offering on their website. Typically, you'll be able to print a card. You may have to apply for it, but the application process is pretty straightforward. But typically, once you get it, you're given a card that you can present to the pharmacist. This can significantly reduce your cost. Sometimes well less than $100. I've seen them come from like $300 to $30 a month for 6 months. So that's a significant savings for a type of prescription that you have to have on a regular basis. And maybe your insurance company doesn't cover at the amount that is needed. So I hope you found this helpful. This is just one of the other ways that you can rig the game in your favor. And I talk about how the healthcare industry is actually rigged against you, but there are ways to rig it in your favor. If you want to learn more about how to do that, just check out insuremesteve.us/rigged and watch my free video that will help you understand how you can rig the game in your favor. If you haven't already, please remember to, there it is, subscribe and like this channel so that you can learn more about how you rig the game in your favor. I hope you found this helpful, and I have a great, fantastic day. Bye-bye.